Welcome to Root Cause Wellness, the podcast where we go beyond symptoms and Band-Aid fixes to uncover the real reasons your body, mind, and hormones are screaming for attention. Your host, nurse practitioner Jenna Darnell, and certified nurse midwife Heather Witters are pulling back the curtain on mainstream medicine, sharing honest conversations, and bringing you evidence-based, no BS information so you can heal deeply. Whether you're dealing with fatigue that won't quit, hormones that feel like a roller coaster, gut issues, infertility, or you just know something is off, this is your space. This is Root Cause Wellness.
Okay, so second podcast, and this is going to be one that I'm going to kind of learn lots of things, I think, from you.
Well, I was hoping we could just get together and chit chat about a little thing that I'm obsessed about because it's always on my mind. And so I just want to have a conversation. It might turn into a TED talk because I think about it all the time. So let's just get into it. I have been in the women's health kind of field for almost 25 years. Most of it as a labor and delivery nurse. And I just want to acknowledge how much things have changed in terms of pregnancy health and outcomes. I was just talking to my director not very long ago, and we were talking about how, like, when we were little baby nurses, when we had a hypertensive patient come in, it was like a big deal because it didn't happen very often. We were like, lights are dimmed, one visitor, we were terrified of seizures. Like, pregnancy hypertension is terrifying, appropriately so. But now, so many women are hypertensive in pregnancy that we just don't get as fired up about it because it just has become the norm. And I think that's so sad. So that's just an example of how our declining metabolic health in society, in our country, is affecting our pregnancy outcomes.
Well, and I wonder, is there any studies or research that's been done that shows a link between a pregnant mom that has had GDM or hypertension or any of these kind of pregnancy-related metabolic dysfunctions that it is passed on to their child?
Yeah.
I mean, I'm pretty sure I've read that somewhere.
Well, specifically diabetic moms, so that insulin resistance is passed on to the baby. So you have diabetes in pregnancy, whether it's type 2 or gestational diabetes, and then your baby will likely have glucose regulation problems after birth, will probably be overweight. These are in women that don't have well-controlled blood sugars, right? So I'm talking about then those babies throughout their life are more at risk for having metabolic disorders, including diabetes. Yeah, it just goes on and on and on. And women who have gestational diabetes are at risk to develop type 2 diabetes, high risk. And we don't have those conversations with women. Yeah. And I guess the conversation I was hoping we could also have today is how we can affect that upstream. Because if we could just get women healthier before they go into pregnancy, we are literally affecting the health of the next generation. And so I really, really, really am just obsessed with helping women understand this. And so my thought is that if we spend 9 months growing a human, right? If we could spend 9 months before trying to get the woman healthy before she goes into the pregnancy, and sometimes it takes less time, sometimes it takes a little more, but that's just like a generalization, we will really affect pregnancy outcomes and infant health.
And I wonder, so currently, like our current system is, well, I guess you become pregnant, you make an appointment, you go see your OBGYN, whoever you choose. And usually you're at that point, usually 9 weeks, just how it kind of works out.
Ish.
And so, and I think there's some type of conversation being had as far as, okay, these are the amount of weight we want you to gain. It decreases if you come in with a higher BMI than you should. It decreases the amount of weight you should gain during a pregnancy. But do you think like a conversation kind of around that would be helpful?
I don't know. I don't know that the weight conversation is always the thing. I think it would be nice if we had more conversations about just the pillars of health, and whether that's preconception or during pregnancy. Like if we talked about nutrition and eating whole foods with every single pregnant mom, like if that was really a deep conversation, if we had time, if only there was time. But instead of, what happens is we wait until a woman's diagnosed with gestational diabetes, and then we start talking about what her diet should look like, what her nutrition should look like. And it really should be about, like, you are growing a human, and at 9 weeks, that's probably sooner, is that the time to be talking about it? Because your baby's growing its organs, not
Yeah.
at 28 weeks.
Yeah. So I guess it starts before pregnancy for sure, it sounds
Mhm.
like. But yeah, how to kind of get that message out. I wonder, is there any I guess anything out there available for women that are wanting to conceive that they can like be a part of I don't know, a group or anything that's like pre-pregnancy support or anything like
Yeah,
that?
I think there for sure is. Like, it's all over social media, but I think it almost needs to become a movement. Like, I just want to talk about it more and more. And maybe if we can just get society really talking about it, it really needs to become a movement about like getting healthy before you become pregnant instead of I'm pregnant and now I'll take a prenatal vitamin.
I feel like people that, we're talking about weight, so, people that are overweight that do get pregnant that come in, I do feel like they probably generally don't they have a harder time getting pregnant,
For
I would
sure.
say. I mean, it's definitely more challenging because that can lead to like PCOS, where you're higher in androgens and not ovulating, potentially as often as other women. So
But all the
yeah.
things you're saying right now, again, go back to it's all metabolic health, right? It's all metabolic health. Insulin resistance is just at the core of so many of these problems. And so, if we can help all women become more sensitive to insulin, and then we're going to grow a healthier baby because insulin resistance affects every single cell. It overwhelms them with like they get sluggish, mitochondria don't work as well because they're just overwhelmed with this. They're like overfed as a society. We're overfed, right? And so you're growing this little baby that's just basically a bundle of cells. So think about how that is all of your cells are unhealthy. How in the world are you going to grow a little bundle of cells inside of you if you haven't fixed your own cellular health?
I think it was Joe Rogan. That's what popped in my head. It was like, I don't know where this came from, but like we're the only species that has like you don't see giraffes or lions or these animals that are obese. You see dogs that are obese only from the humans.
Yeah, we did that.
Yeah, we did that. But it's like we're the only like species that's got this obesity problem. It's like I guess we'll talk about that probably on every podcast. Well, okay, why? Well, it's the foods we're eating in our lifestyle, our
Yeah.
sedentary lifestyle, and so yeah. I think what are the most current stats on pregnancy? I mean, I know that's huge in the, news as far as we're not really quite growing at the rate we need to be.
Oh, right. Yeah. So infertility is
Yeah.
rampant. And I don't know what the exact stats are, but even if you're looking at male sperm health, they're saying that male fertility, I think they said, is decreasing it's some outrageous number by like 15% every year or something. Like male sperm health is in the toilet. And so, I mean, our gonads, our ovaries, and our testicles have some of the most metabolically active cells in our whole body. And so, if you're not eating well, you're not sleeping, your stress is overwhelming you, then your gonads are not going to work correctly. So your fertility is going to be worse and worse. So yeah, people aren't able to get pregnant. And so, in comes all of these medical interventions like IVF, and that's not ideal. So,
Have you heard of anything as far as like what the sperm brings to the table as far as like what's passed down through the sperm? Like that's something I feel like heard some rumors about that the sperm actually is the thing that can cause these potential problems in the child down the road. It's not just the egg.
sure.
Men's sperm is
And I don't know specifics on that. I guess I don't have the 100% answer, but I mean, I think again, it's just logically speaking, like if you don't have a healthy egg and you don't have a healthy sperm, then you're not creating healthy cells. You're not creating a healthy baby.
it's like their cell phones in their front pockets.
Sure.
Or all
Sure.
the things that affect men's
Yeah.
sperm.
Yeah. Well, we're constantly exposed to what toxicities in whatever way, whether it's that, like, energy toxicities or chemical toxicities. And I mean, that's a conversation to have too, is like when we think about preconception care, we so often just think about the woman. But man, if you can get your partner involved in getting healthy too, and, starting with just like eat real food, start there. If you can get him on board, it's going to make such a difference in whether you get pregnant and how healthy of a pregnancy you have.
So you're seeing women that are getting pregnant, by grace of God, they're getting pregnant, so they come in. But the metabolic, so you're saying the people that are, having babies right now, you're seeing just a huge increase risk
Yeah.
of just, so hypertension. Is it mostly hypertension?
Hypertension, diabetes. So it mimics the metabolic disorders really that we're seeing, thyroid disorders, autoimmune stuff, right? But it mimics the disorders we're seeing. I haven't seen a chart that shows this, that they're going up like they're mirroring one another, but you definitely can see it in practice. And so they're saying, like, statistics are now showing that 96% of the people, adults in this country, are metabolically unhealthy. 96? 94%. I think they say 6 to 7% of us are actually metabolically healthy. That's a tiny, tiny group of people. And so now half of those people are women, whatever percentage get pregnant. I mean, it's going to mimic that. It's going to be the same. And that's what we're seeing. Like, it's more often when I'm at the hospital, every week we've got 1, 2, 3 people who are hypertensive, probably on medication for it, maybe being treated in the hospital for it, maybe being induced early because of it. It's just not good.
It seems like the time to get healthy and think about that is definitely, like you said before, because I'm just like envisioning, gosh, after you have a little one, and then a toddler, like you're literally eating their chicken nugget, or you're eating whatever is left on their plate, and you're sleeping when they sleep. Like, your health for your own self kind of does not take precedence generally when you're taking care of a baby. So
No.
that's, yeah.
Agreed. And if you can go into your pregnancy healthy and then go into postpartum healthy, you're just going to recover better and feel better. So it's just, there's so many downstream effects if we can just affect it a little bit more upstream. And so, and two, pregnancy outcomes, it's not just diabetes and hypertension. We're also seeing like increased risk of miscarriage. I can't say exactly why that's happening, but we're seeing it more and more. Stillbirth. It's got to be metabolic health. It's just, it all kind of goes back to that. Of course, some of that's genetic and some of it is idiopathic. We have no idea what happens, but if we had healthier moms, we'd have
So like metabolic dysfunction to where potentially their ovaries aren't producing the correct amount of hormones. The progesterone's the hormone that's released to hold on, like preserve that uterine lining to withhold a pregnancy. So potentially there's that downstream effect right there. So
they're not holding on to it.
Yeah. So I don't know, as far as insulin, you've got adipose tissue. So the fat tissue in our body it eats up, it has insulin receptors in it. And so I know, like, your percentile for when you have extra adipose tissue, extra fluff, like your prevalence for having type 2 diabetes or pre-diabetes, whatever, that progression looks like, is like 10 times fold more increase. So muscle is like the biggest combatter of that type of pathway for disease.
And even if we can help women, it's not all about weight, but for sure, if we can help women lose even 5% of their body weight before they get pregnant, 5 or 10% even, it makes a huge difference on outcomes because it makes you more sensitive to insulin. And so that's why I just feel like I just want to like scream it from the rooftops that women need to seek care before they get pregnant. Women are so great about going to their provider once they get pregnant. Like, we get them on this schedule and we're like every 4 weeks, and then, we see them more and more and they show up and it's important. Women probably receive more health care during pregnancy than any person any other time in their life, right? We're really consistent. Prenatal care is important, but we also should be making that important before they get pregnant. And so that's just the little soapbox I wanted to get on today. And I think the fallout of what we're trying to do anyway is just improving metabolic health in everybody. And so that'll reach pregnant girls.
Yeah. Well, it is. It's like whether you're pregnant or not, it's the same thing. It just it kind of compounds exponentially, I think, when you're pregnant. It's just harder to combat, I think, when you have a baby that you're trying to provide life for and grow. It's just harder to tackle. So easier if you do it before, for sure.
Yeah. And especially like with diabetes, we just, I don't know if we're always having the right conversations with women, because we talk about women who have type 2 diabetes, any kind of diabetes, type 1 this applies to, but we talk to them about, we don't want you to grow a great big baby. Like, we talk to them about that size of that baby's the big deal. It is a big deal, of course. Like, babies get stuck. We have shoulder dystocia. Like, that alone causes issues. But I don't think we spend enough time talking about, like, then your baby's probably going to come out and have its own blood sugar issues. Then your baby's probably going to be at risk for diabetes in its future. Their neurocells don't grow correctly. So we may see like downstream behavioral issues. Like, we don't have these conversations. And I think maybe women would do better if they knew better. And so we need to I think the medical community can take a little ownership for them not knowing what they should know.
Yeah.
So
I wonder if there's any, and again, these are just like things like the umbilical cord and the placenta, like if there's, studies that have been done that they're finding, like heavy metals, like things that are passed down, or at least that shouldn't be necessarily, being passed down to the baby in them.
Isn't
So
that's
it's like,
scary research? I think that wakes people up a little bit when you talk about like glyphosate or plastics, heavy metals. Yes, in the placenta. That's terrifying. And pretty much like in every placenta, and I don't want to fearmonger either, because there's just some piece of that like we can't really affect. We need to do the best we can, but we live in a toxic world. So we should try to affect the things that we can. Like, let's get away from ultra processed food. Let's change the things we put onto our bodies, those things that we can affect, because some of it's just like, it's in the water, it's in the air. Sorry. And I don't want people to be terrified either, but if you can just make little changes to minimize as much as you can in your environment.
I know. I always feel there's a feasibility that kind of comes into the conversation at some point. Like, man, if I had a limited amount of money, I would be having, I would have osmosis and all this stuff, all this technology that, that helps try to, then I don't want to live in a sterile world.
No.
Like, I think like the little microorganisms are so incredibly important, and they deserve their own podcast. I feel like that's like, people that are consistently putting on hand sanitizer, wiping down Lysol off their bare hands, exposing your body to these chemicals. I don't think that's what's,
No, you're messing with your microbiome for sure. You're killing your own microbiome.
Antibiotics.
Oh, that's a whole thing. Well, and especially in pregnancy, because you're not only affecting your own microbiome and your own gut when you take antibiotics, and some of them are necessary. Gosh, antibiotics are life-saving, but they're way overused. And if you take them during pregnancy, you're also affecting your baby's microbiome. Like, it's just so, like, it's all this trickle-down effect. So,
this is like what led me kind of on this journey as far as where I'm at right now. I was always asking, well, how, like, why and how? But like, how did they used to preserve food back before they had refrigeration? They would ferment almost everything or brine it, But like the fermentation process is like now scary. It's like, botulism, like, and so again, more like fear. It's like, okay, it's not hard to do. It's easy to do. And getting those like lactobacilli and like re-inoculating your gut with things that actually help digest and break down these foods so that you can actually absorb the nutrients. Like, we've lost sight of all that too.
we really have.
And so kind of digressing a little bit away from, sorry.
No, but I think it comes back around. It totally connects. But like, for instance, Group B strep is a reason that because we swab a woman's vagina and anal rectal area for that. And if she's positive for Group B streptococcus, which is not an infection, it's just part of our microbiome that happens to maybe overgrow in your vaginal area. A lot of times it's if your microbiome's off, like if you don't have enough lactobacillus, then the GBS kind of takes over. But the point of this is that it all comes back around to if your gut isn't healthy, then that's when you can sometimes end up with that Group B strep. So when I talk to women about a protocol to try to prevent Group B strep, it doesn't always work, but a lot of times it does. It has, the base of it is improve your gut health. And that's take a probiotic or eat some sauerkraut, for God's sakes. Eat some fermented foods.
Can we talk more about this?
Yes, do it. Yeah.
So leaky gut, I feel like that's like, whether that's a medical term or not, we've all heard about leaky gut for the most part. That really speaks to, I think, like down to like if you had, I don't know if you had an animation that had little projectile fingers, with tight junctions, and then these little villi, they grab the nutrients as your, bile's digesting and breaking down food. So they're grabbing the micronutrients with, leaky gut, and then like chronic long-term inflammation. So that means you're eating something that's causing a reaction. And so you have this inflammation reaction. So celiac, those little finger-like things, they get shrink. They're smooth. They're not, they lose the ability to actually absorb, nutrients. And so, and my question is, is celiac truly, is it something that you just develop because you have, epigenetics, like you were, predisposed to developing celiac, which is an autoimmune disorder? Or is it just something it's an inflammatory thing and you're eating foods that, don't go well with you? I mean, that's kind of the question. I think autoimmune is kind of a big question.
Yeah. But I think it has to be impacted. Our environment impacts it 100% because if you look at the drastic increase in autoimmune disorders just in the last 10, 20 years, drastic. That's not genetic and that's epigenetic. That's our environment for sure. Don't you think?
Oh, 100. I do.
I mean, I think research
I think
supports that.
it does.
Too.
I
It
just
shows
wish that there was more studies that could, like when we're saying on this, we're research-based, evidence-based. And it's like, I think that's something that they're kind of looking at is like, okay, this is just our body's reaction to kind of, attacking itself. Autoimmune is kind of, that's what it means. Like your body is maybe a little confused and it doesn't know what to, usually it fights foreign fighters like virus or bacteria, but maybe gets a little bit confused or hypervigilant and starts kind of attacking, your own body systems. And so that's where you get autoimmune disorders. Gosh, I don't know the exact number, but there's a lot of them and they're all, MS is, obviously your nerves and you've got celiac, it's just gut and there's so many of them. So it's not,
Well, I wish we could talk more to people, and we're here. That's what we're going to do. But I wish more people knew that they could impact those autoimmune disorders because so many people think it's something that happened to them. Like, can't do anything about it. I have a thyroid disorder. But we just need to educate about how much their lifestyle can really, like, there are people that go into total remission from many, many incurable autoimmune disorders by changing lifestyle.
I maybe might interject a slight personal story here. Is probably 15 years ago, when I was doing night shifts working as an L&D nurse. And so I think I was probably early 30s at that point, and had no clue. I mean, I ate, my healthy idea of eating healthy was, maybe low fat, yogurt, margarine. This was information coming from my poor sweet mother that just was trying to do the best by us, but we didn't know. This is just information that we just didn't know. So there was no diet that I followed back then. But I started suffering from like irretractable pain, sternal pain. So not like chest pain, but like joint pain that was like debilitating. And it got to the point it was like waking me up every single night at 2 to 3 a.m. in the morning. I'd get out of bed. I'd go lay on the floor in the middle of the night just to stretch that sternum. And like, you do that, trust me, enough nights and you're like, I can't do this anymore. What is wrong with me? And so you start down the rabbit holes. But long story short, I cut out gluten because, so I stumbled upon that gluten can be an inflammatory food. Took 2 months and the pain went away. And then that kind of started down. And that's kind of, I guess, would be how this all started. It's like, wow, food is huge. And
it's everything.
Yeah.
Everything.
And there's so much more to know too. I'm like literally learning. I think you and I both are pretty passionate about growing our own food. Not everybody has the resource and time to do it, but are we digressing too far?
I don't know. I think nope, I don't think we are. We're not at all because it all comes back to getting healthy, and eating real food. And that's why we're, to speak to our gardening or sourcing from farmers or farmers markets, but people need to eat real food. We had a conversation before we start recording because that's just what we do, sitting at these conversations. And we kind of go back and forth about like, what's the perfect diet? And you need these amino acids, you need these phytonutrients. But like the thing we all can agree on is just eat real food. Like if it looks like it did when you butchered it or when you harvested it from the ground, that's what you should be eating. And we could really just simplify it for people.
And it tastes, I think I have a cookbook that's actually 5 ingredients or less is like what the actual title of it. And it's like you can get really creative and things taste good. You develop the flavors like by roasting or cook different ways of cooking it. It doesn't have to be boring. But yeah, if you can pronounce every food item in what you're eating, that's a good start.
Yeah, eat that. And it does come back around because especially like speaking to women who have gestational diabetes, and then you have a conversation with them after they've met with a dietitian or been given the list of what they should and shouldn't eat. It's so much about deprivation. It's so much about like, oh, I can't have this or that. But really, if we can start teaching people to look at it a different way, like eat real food, it tastes better. It'll make you feel better, feed your cells. And then it's not at all about deprivation. And so I think if we could just start teaching people, and women in particular, because that's where my passion is, then we're going to have better pregnancy outcomes. So we're not digressing. We're on the track.
We looped it.
We looped it back around.
We're good at that.
Yeah.
Well, and I do think so. Like food is huge, obviously, but there's also, I don't think we can the moving your body more. I mean, again, like we mentioned, sedentary lifestyle. I mean, we were never meant to go sit down at a desk all day and sit there and, be having like the blue light from a computer and just sit there. Like that is not what our bodies were meant to do at all. And so, purposeful movement is kind of what I usually say. That's, I just say purposeful movement. So it doesn't mean that you have to go to the gym, get workout clothes on, go get sweaty. No, it just means walk your stairs for 10 minutes or whatever. Do something where you get your heart rate up. You're doing something extra every day. Ideally, obviously, it's 25 minutes a day is, that's obviously sometimes not in the perfect world going to happen, but move your body more. Muscle is huge and stretching is huge. I mean, to prevent, as you get older, stretching is huge.
It is. Yeah. And maintaining your muscle
Pregnancy,
mass. And the time that your body takes up glucose in the absence of insulin, the only time is when you're exercising, right? When your muscles are metabolically active. And so same thing's true in pregnancy. I think pregnant women feel like I don't know if they feel like they need to rest more. I don't know what the thing is, but I think we just need to remind ourselves to move our bodies every day. Move every day.
We're human. Like we know that this is like saying like what you should be doing and doing them are two different things generally. But like a habit comes, do it every day for 3 months. It becomes a habit, and ultimately you've got one life to live. We're on this earth for 90 years. Here's my soapbox. I guess like 90 years, maybe if you're lucky, 100 plus some. But what do you want that to look like? And you are in control of that to an extent. Does get to be an age, I'd say, that you lose a little bit of that control. It's hard if you've not done anything for, diet and exercise, when you get to in your 60s, that's a hard thing to come back from, but you completely can turn things around at any age with intention.
Agreed. With intention, for sure. Yeah. And I think that during pregnancy, it's one of the times that women feel the most kind of inspired to get healthy because they're doing it for their baby. And I guess I'm trying to inspire a little bit sooner. Like, just remember, you're not just doing it for yourself, you're doing it for your children, the next generation. So you have control over how you're going to live, how long you're going to live, what your, quality of life is going to be, but you also can impact how that's going to look for your kids, which is motivating, super motivating.
100%. And I just wonder, like, there's such a decline on people wanting to have kids. Like there's the shift that seems to be happening. So our pregnancies are declining. So people are getting pregnant. I don't know, if it was something that accidentally happened or if they tried or whatnot. I'm not saying that, but I'm just wondering if the people that are trying to get pregnant, if they had resources available to them that, what can I do? What all are the things that I can do to try to optimize my chance of having a healthy pregnancy? It's not, like you said, it's not even getting pregnant. It's sustaining that pregnancy in the best way possible. Because miscarriages, you said, are on the rise.
Yeah. And I think not only for sure some people are opting to just not have kids. Is that because the world's scary? Because it is. But also what we're seeing is the people who are planning their families are opting to start later. So we've got older individuals having their first babies. And so, you kind of, if you aren't doing the things that you should be doing to be healthy, then you are at increased risk. Like we're calling them geriatric pregnancies, which just cracks me up. 35 years of age. Geriatric. We call it advanced maternal age. It's AMA, but I've seen it in some of the prenatals as geriatric, which just cracks me up. But it's because it does put you at increased risk for some of these disorders, including hypertension. But it doesn't have to be that way. Like if you are a healthy 39-year-old. You can have a perfectly healthy pregnancy, but you need to be, again, like intentional about it.
Yeah, I think like, and I think people that honestly, and I'm going to use an example of a non-pregnant person, but like a patient that is a diabetic, type 2 diabetic, maybe mid 50s, and we're talking about diet. And it's like, okay. And I ask, what type of, do you follow a certain diet? Do you follow a diabetic diet? And they're like, yeah, I eat healthy. I eat a whole foods diet. I'm like, okay, I want you to give me examples of things that you eat every day. Give me a breakfast, lunch, and dinner breakdown and snacks. I just want to know what you eat. Well, they eat oatmeal with some, granola on top with some brown sugar, butter, and then the oatmeal. So you start breaking down the actual caloric intake and the glycemic index of what they're actually consuming. And they think they're eating healthy. And in their mind, they are. And they've been told that, Cheerios or oats are heart healthy. And, but I think we've been all kind of misled as far as what's truly healthy. So to you, curious, like what would be like a good, like, give me an example of like a breakfast, lunch, and dinner that a diabetic or someone, a mom trying to get pregnant.
Yeah. So when as a generalization, when I'm trying to educate people about eating real food, whole foods, I generally try to like direct them towards the Mediterranean diet, right? So vegetables, lean meats, although I am a believer in red meat. We'll talk about that later. But I try to just direct them in that way because that at least gives them somewhere to search, like something to look for. And I think we're learning this more and more about focusing on protein in the morning. So that's where I try to start with moms is protein. So I'll tell you what I ate for breakfast today, and that's what I tell people to eat. So I eat protein. This morning I just had some organic sausage that we had, but I cut up a bunch of organic kale and put it in there and a big old spoonful of sauerkraut. And that was my breakfast. And it was fabulous. Like, it's good for my gut. I'm getting my phytonutrients. I got my protein. Like, we don't have to complicate it either. But you're right. I think people don't realize. They think oatmeal is so healthy.
Yeah. And I think that there's just like our food pyramid that came out. I don't know when it came out, but it was so wrong. And sponsored to you by, somewhere that's
General Mills?
Yeah.
Cereal. Fortified cereal.
Yeah. We're finding that and folic acid is maybe something to talk about, the fortified folic acid and all these grains that we're eating, and how maybe that's my soapbox, the MTHFR gene mutation, as far as like how they're finding that there's like 40 to 50% of people that are, that have this gene mutation. It's called let's call it the MTHFR gene mutation, but it just means that your body is unable to actually convert. And so folic acid is not the usable form that your body needs as folate. And so, but if you're consuming folic acid, which is what's fortified in these grains, breads, what have you, your body can't do anything with it. It actually causes people to have like anxiety, palpitations, and some like really weird symptoms. And so that's very interesting. So, but something that's needed in pregnancy.
Yeah. And is in most prenatal vitamins, folic acid. We load up on it, like 400 milligrams of folic acid every day in your prenatal, or more if you have a history of neural tube defect, like 4,000. It's a lot. And that can build up in somebody's body if they're not able to methylate it because they have MTHFR, which many of us have it and don't even know it. And so, I think taking a methylated version of B vitamins is super important, and people don't realize. I don't know why we're putting folic acid in anything with the number of people.
Neural tube defect. I mean, there have been something.
But why aren't we just doing folate? Why aren't we just doing methylated B vitamins? Now that we know.
They need to circle back to that.
Yeah, let's readdress that. Now that we know. Because it's such a huge percentage of the population that can't do anything with it. Causes problems.
Controversial brain is like wanting to go through. And I don't know, like vitamin K shots for infants. Do you have an opinion on that?
I am currently researching that, and so is the hospital. I mean, I think everybody's looking at it because parents are questioning the injections that their newborns are getting and like, what are the additives and all the things. And so I know that in a lot of other countries, like the Netherlands, developed countries, they use oral vitamin K drops and they seem to have good outcomes. But here in the United States, we just don't really support that practice. We do injections. And here's the thing is that vitamin K, if you have a vitamin K deficient bleed, like a brain bleed in your baby, and that's your baby, it's catastrophic. I don't know what the percentage is. And I actually have like an article sitting.
We'll circle back to this
home.
Because I think
we'll dig into it.
And like this, the things that we're given to our children, this is something that, Yes, it's very controversial. People are going to
Mhm.
have, and there's things that are coming out right now, that they're looking at. I just think it's something to talk about.
It
And
is.
I'd like to remain like it's, your baby, your decision. But I think informed consent
Mhm.
is something that we could do better on.
Yeah.
And so, just kind of shedding the light on that. But
And a couple of pediatricians that we've talked to about oral vitamin K drops as an option, they say, we're not going to do that because parents won't follow through, which I think is just so disrespectful. Because give parents some credit, for God's sake. Like, if that's the only reason we're not doing it, I'm not saying it is. Like, I really am in the midst of this research so I can better understand it to educate people so they can make their own informed decision. But if that's the only reason, then we're doing them a disservice.
yeah, and I guess I have not yet read something that's changed my mind on like a Hep B vaccine for,
Mhm.
a newborn. Hep B's, transmitted through sexually,
Yes.
transmitted.
Yep. IV drug use or
So, I
sex.
mean, and that's something that's tested every woman. And, I
Yes.
guess maybe we're getting that, I don't know, it's not 1%ers, but the percent of women that come in that maybe had no prenatal
Yes.
care. And so every baby gets it.
Yep. That's what we were trying to cover. That's
yeah.
exactly
And
right.
so maybe that needs to get looked at again. I'm just
Mhm.
saying, like maybe the women that have had zero prenatal care, those babies get it.
Mhm.
Just saying, like,
Yep.
I think again, parents need to just be informed, and that's all we can ask for there.
And I think we're seeing more and more of that. It just makes me celebrate. Like, it makes me so happy when families come in and question it in an educated way. Like, they are educating themselves. They're not just bucking the medical system. Like, they're learning better so that they can do better. So I love that families are advocating for that and opting to not. Just like, I mean, yeah, I just don't want us to ever just continue to do things because that's the way we've always done it.
I would hope that we're evolving in what we're learning. Oh, I mean, we've come some distance from where we, 100 years ago,
Mhm.
oh my gosh. And, but I think we can, maybe relook at some things. And I think, we both are very much, we don't want to be spreading any kind of, misinformation or, like you said, fear mongering people where we want you to, no, we want just people to be aware that maybe there's some more questions to ask.
Absolutely. Absolutely.
And that's really all. Again, no one will ever be your best advocate besides yourself. So,
Yeah. And you can't just blindly trust the system. I mean, and in pregnancy, like the United States, we apparently have the greatest medical system on earth, but we have more maternal deaths than, almost any other developed nation on earth. So what are we doing?
well, and I feel like if you look at, there's got to be, I can't recall the exact study I looked at, but it's for their ranking countries as far as like how much they're spending on healthcare,
Mhm.
and then as far as the disease prevalence, so like chronic disease more so, we're not, for how much we spend and where we're ranking at, we're not doing good.
Oh, great.
So again, I guess, yeah, that right there speaks to maybe we need to look at our system a little bit
Yeah.
closer.
And do things a little bit differently. And again, that's kind of why I'm really, really trying to advocate for preconception care. I just think we have to kind of address this in a different way than we are to improve our outcomes downstream. We spend so much time in the hospital researching and updating policies and doing, order sets to try to address these hypertensive crises. And, but I just think, well, why are we not going upstream and figuring out why these women are
Well, can you
falling in the river? Like, why are they sick? What, we wouldn't have to do all of this downstream stuff.
maybe paint the picture? Like, what does that look like for a pregnant mom coming in with hypertension?
Mhm.
Like break that down so
Oh.
like people know, what does that even mean?
Yeah. So hypertension is high blood pressure. And if you have high blood pressure in pregnancy, it's a spectrum. There's a whole range. Like, you can have a little bit of high blood pressure. We just keep an eye on it. Maybe you're high enough in pregnancy that we can keep you pregnant, but we start an antihypertensive, like a medication to bring the blood pressure down. Maybe we induce you a little early. But the end of the spectrum is the hypertensive crisis, preeclampsia, which is a hypertensive disorder that involves every organ in your body, like brain swelling, your liver can rupture, kidneys can shut down. It's catastrophic. And you can have something called eclampsia, which is a seizure. The biggest risk that we're finding now with preeclampsia is stroke. Moms are having strokes. You have a newborn infant at home and you may not be able to go home to that baby. Like, I'm getting chills. It just makes me sick. And so we just need to never get to that point. And so those women come into the hospital, They have to be treated emergently with medications to bring the blood pressure down, to prevent seizures, like magnesium sulfate, which makes you so sick and miserable. You can't enjoy.
Well, stroke, and then if their liver enzymes get to the point their platelets drop, there's something called DIC where you just stop
Mhm.
producing the ability to clot and you
Yeah,
literally
you just
bleed out.
bleed.
How scary is that?
Yeah.
So scary.
And if we could, there's lots of things in play. We don't know 100% why preeclampsia happens, but if we can go upstream and improve our health and prevent a lot of that from ever happening, I just think we need to do it. We need to have that conversation with every woman.
I think I don't know, our next podcast, I think we should talk about like all these peptides, like the semaglutide, the tirzepatide, this new one, the retatrutide, and then like, sort of the metabolic dysfunction disorders. I
Yeah.
think like that there's a lot to talk about with that and with weight loss and kind of, how that could wrap up into that.
I think that's a great idea because so many people are looking at peptides just for weight loss or muscle building right now. But when you look at the other positive outcomes on like cardiovascular health, I think we need to really talk about that because there's so many options to help you get healthy. Like sometimes we need a little help.
Yeah. And if peptides are things that
Yeah.
your body creates naturally, but as, again, I'm going to say systemic inflammation, I feel like way too much on this, but if there's a dysfunction in your body, then those particular amino acids, those peptides aren't being able to be created as they should be.
Yeah.
And so you have that dysfunction there. So that's why a little bit of these peptides sometimes done in the right way, done in the right amount can be helpful to do, along with your health journey. And I
Yeah.
think there's a lot to talk about with peptides. So
Okay.
did we talk about everything with the pregnancy and fertility?
For now, I'm
For
sure
now.
we'll come back to it depending on how fired up I get day to day.
All right, until next time.